Over the last 13 years, Bonni has evaluated thousands of patients. And in 2020, she published the book, Cannabis is Medicine: How Medical Cannabis and CBD are Healing Everything from Anxiety to Chronic Pain. So please welcome Dr. Bonni Goldstein.
Hi, everybody. So nice to be in Portugal, and I just want to say thank you to Laura and her team for bringing us out here so that we could, I can share my clinical experience taking care of children with medical cannabis. And I'm sorry, how does this work? You just press up? There we go. Okay. All right, so just a little background on me. So I trained as a pediatrician about 32 years ago at Children's Hospital Los Angeles. At the time, I was a bit of an adrenaline junkie, and I went into pediatric critical care transport medicine, and then went into pediatric emergency medicine, and I did that for about 14 years. And around 2007-ish, I became a little burned out trying to be mom during the day and doctor at night. And after years of doing that, I took a break. And during that break, someone asked me about medical cannabis. And I'm ashamed to say I didn't know anything. As a physician, we had already had it in California for over 10 years, but I knew nothing about it. And so I started doing some research, and I just became intrigued. And I haven't turned around since. I've been moving forward. It helped that person who was a friend of mine. And since then, I've treated thousands and thousands of patients. I've written 2 books. My last book is Cannabis is Medicine. And just in the last year and a half, despite COVID, I was able to publish some research that I'll share with you about the impact of medical cannabis on children with autism. So let's move on here to the list of diagnoses that we see in pediatrics. So we see intractable epilepsy. By far in my practice, that's the number 1. And very close, number 2, is autism, usually the children with moderate to severe who are not functioning well at school or at home, where there's a lot of difficulty and it's really affecting the whole family. I would say third on the list is cancer. Unfortunately, many children with cancer do not make it, and we know that cannabinoids can not only help with the symptoms and the symptoms of cancer and cancer treatment, but also can help with potentially the anti-neoplastic effects. And then we have a whole list of other disorders you could see here: GI disorders like Crohn's disease, ulcerative colitis, attention deficit, Tourette, some psychiatric conditions, chronic pain, genetic conditions, and sadly, end of life. And this photo you can see, this is a young adult that I take care of. He's been my patient for, I think, going on 8 years now. He came to me having probably 15 seizures a day, multiple different medications over years. The mom had a stack of notebooks of every seizure and every medication change, like this tall. And he was going to be evaluated for brain surgery, and they decided to try cannabis before they did that. And he had amazing results. And this is a picture he sent me that he drew for me about how cannabis opened his eyes and gave him his life back. So it's a very meaningful thing to be able to help these patients. Now let's move on to epilepsy. So in 2000, a report came out that showed that only 64% of epilepsy patients respond to conventional treatment. Well, what about the rest? They usually struggle, and they try medication after medication with a less than 4% chance of responding. In 2018, the same group decided, well, after 18 years and different kinds of medications that have come out, has the number changed? Have we improved the number of patients that are responding and are fully seizure-free with cannabis, with conventional medication? And it turns out that more than 1/3 of patients still remain uncontrolled epileptics and really have very minimal options at that point after medication. A nerve or a nerve stimulator, magnet implanted, are now moving on to brain surgery. If you look at the interest in cannabis, though, as you can see and remember from Dr. Mashulam's study this morning, he reported 1980 was when he did a study, and then really nobody did anything with that. And if you look here, you can see that there's some interest starting in 2012 and 2013, and that's when CBD strains of cannabis, high CBD strains, began to be available in my area in California and in Colorado. And then in 2013, there was a documentary that came out by CNN where Dr. Sanjay Gupta, who's one of their medical correspondents, talked to a family of a little girl that was sent home to die. She had Dravet syndrome. And her parents found some cannabis growers that had something that they called hippie's disappointment, because it was very high CBD and very low THC. You couldn't get high off of it, and so nobody wanted it. But they turned it into medicine for this little girl, and it was an amazing medicine for her. It reduced her seizures from 50, I think 1,200 seizures a month down to about 3 a month, which was life-changing. She learned how to speak and to ride a bike and to interact with people. And so you can see that after 2013, there is this incredible increase in the number of publications that are, if you just look at cannabidiol and epilepsy in the title, you can see the interest has really grown exponentially. So now in the early days, when I first started treating patients around 2012, 2013, we really had no data. I was very, very careful. I was, tiptoed up on CBD. I made sure we knew the products that we were using. But we started to have some reports in the literature of these patients. So this first report is a neurologist I know at University of California, Los Angeles, and he recruited 117 patients that were using CBD. Many of them were my patients, and they just did a survey. That's all they did, was just ask questions. So 85% of parents reported seizure reduction. Even if this is not fully true, this is a very high number, even half of this. Remember, these are intractable patients who have not found any treatment to work. 14% was seizure freedom. That is a huge number in this population. And what they saw in terms of side effects, beneficial side effects, more alert, better sleep. And then we have the following year in 2016, a report out of Israel with 74 patients treated with a 20-to-1, 20 parts CBD, 1 part THC, what we call artisanal oil, so whole plant. 89% reported seizure reduction with benefits of more alert, better language, better sleep, motor skills, and communication. I think one patient in their group became seizure-free. The third report here, Sulak et al. 2017, I co-authored with Dr. Dustin Sulak, who's a cannabis physician in Maine, and Dr. Russell Sinedo, who is a pediatric neurologist in Seattle, Washington. And we pooled our patients, 272 patients treated with medical cannabis, all children with intractable epilepsy, mostly using CBD high ratio, but we also, of course, in these states have freedom to use THCA and THC. At that time, that's what we were using. And we had an overall 86% of parents reported seizure reduction with a 10% seizure freedom. So you can kind of see a repeat in the 80% range. You see 3 different groups finding very similar results. In terms of side effects, very mild and infrequent, and very similar benefits that were reported previously. And then this fourth report comes out, and this was one a little bit different. They were looking to compare CBD with a drug called clobazam, which is a very common drug used in the United States for children with intractable epilepsy. It is a pretty heavy-duty benzodiazepine in the Valium family. And what they found was that just when they added CBD to the patient's current regimen, they had a 39% had greater than 50% reduction of seizures, and they saw 10% seizure freedom. And what they found, very interestingly, which really to me was the take-home message here, because I know after looking at all of this and seeing my patients, I know CBD works, but what they found was CBD, the effects were comparable to clobazam, but had much, much fewer side effects. And also, I will tell you that the kids that go on clobazam, if it doesn't work, to get them off, it can take, I had a patient, took them 3 years to wean off this drug because it's so highly addictive. And we don't see that with CBD. So if you're seeing comparable effects, why wouldn't you go for the drug that has the enhanced side effect profile? So now, what do we know? After all this time, we're now in 2022, we know that the current clinical research supports the use of CBD to treat refractory epilepsy, and it should not be a last resort medication. The definition of intractable epilepsy is after 2 appropriate drugs have been tried. And after that, the chances of responding to number 3, number 4, number 5, and so on is less than 4%. I have patients that have lost years of their lives trying 20 to 22 different medications. And remember, this is a developing brain. This is in a child. Why wouldn't you go to the non-toxic plant? If it doesn't work, you can always go back to the drugs. That's kind of my approach. And here we have a report. So Gaston et al. Reported, this is just a purified CBD in 89 children and 80 adults over 2 years. And there was a significant mean reduction in seizure frequency at 1 month, 1 year, and 2 years, all statistically significant. I'm missing, there it is. And as you can see here, 1 month on CBD, the greater than 50% seizure reduction, which is kind of considered the clinical definition, was at 46%, but if you hung on and continued to take it, you actually had improved over 1 to 2 years. So you can see 46%, and 1 year on CBD is 55%, and 2 years at 61%, reporting this greater than 50% seizure reduction. And in adults, same thing, 31% increases to 52% on CBD. And the way to kind of think about this is, remember that the brains of someone with epilepsy, it's not just overfiring, but there are changes going on in the brain. There are certain type of receptors that are changing and neuronal pathways, and especially in children, I call them moving targets because they're growing and changing and developing every day. It's always so hard to know what's going on. But the point here is that you get better results the longer you are on CBD, and I certainly have seen that in my clinical practice. This last point here, significant difference in seizure severity by year 1, with adults reporting greater improvement in seizure severity, but we see that in pediatrics as well. So again, here we are a few years out of this social experiment where, especially in California where I am, doctors are allowed to practice medical cannabis, but I'm not allowed to do research using the plant, believe it or not, because of that federal restriction that Dr. Hart was talking about this morning. So I'm allowed to treat, so it's really kind of the clinical practice and kind of the anecdotal evidence is outpacing some of the research. But because now we did start seeing the use of CBD 2013, 2014, 2015, we now have years under our belt and can start to see some of these reports coming out. So in 2021, a report came out looking at the EEG of these patients and also the effect on sleep. And what we're seeing is that CBD actually does change the EEG for the better, decreasing evidence of the neuroexcitatory brain, and that was statistically significant. Also, CBD use improves sleep microstructure based on the EEG in almost 85% of those with abnormal sleep. And then we have another report from the same year, cognitive and behavioral tests before and after CBD. 89%, this is a very high number in the medical world, remained stable or showed reliable improvement after just 3 months on CBD. And cognitive and behavioral changes were not correlated with the CBD dose, but improvements in short-term and working memory were significantly related to better therapy response, and they didn't see any adverse group-level effects in this particular study. So again, here's all this data kind of supporting what I saw clinically in the early days. Now we have this larger body of data reporting on these benefits. And here we have another report from last year. This was observational, but they looked at quite a number of patients, 280 patients, 71 adults, and 209 children using CBD, compared to 138 patients not using CBD. And look what they found. CBD users had higher quality of life, lower psychiatric symptoms. And by the way, this was artisanal CBD, meaning whole plant, not purified. Better sleep, better seizure medication tolerability, improved health outcomes longitudinally, use of fewer prescription medications overall, and reduced healthcare utilization, meaning saving healthcare dollars, very important. Here's a study that came out from Pamplona's group looking at comparing CBD-rich cannabis extracts over purified CBD. So the whole plant cannabis versus just an isolate of CBD in treatment-resistant epilepsy. And what did they find? So they looked at a total of 670 patients over 11 different references, and you can see this very wide range of dosing of CBD, which is very important, and I'll talk about in a future slide here, but 1 to 50 milligram per kilo per day, and the treatment length was 3 to 12 months with a mean of 6 months. So 64% reported improvement in the frequency of seizures, meaning a reduction. But there were more reports of improvement with the whole plant, the CBD extracts, at 71% versus the purified CBD at 46%, and that was statistically significant. But if you use the standard clinical definition of greater than 50% reduction or more, if you apply that, there's no difference. They're both equally effective. However, why would you pick the extract over the purified? Well, the extract patients were able to take a much lower dose, 6 milligram per kilo per day versus the purified at 25 milligram per kilo per day. And what I have seen is with this very high dosing, that's when you start to get into the side effects. CBD can have side effects at very high dosing. So when you compare mild adverse effects, the extract at 33%, by the way, I do not see that 33%. In a clinical practice, it's a little bit different because you can change things to accommodate and fix the side effects. But in this, they found the extract had 33% mild versus the purified 76%. And in severe side effects, extract 7% versus purified 26%. So a big difference in when you're using whole plant, getting that synergy, or what Dr. Meshulam calls that entourage effect. There's other compounds in there doing some of the heavy lifting, and you will be able to reduce the side effects. Some of my patients who take very high doses of CBD are getting the prescription drug from CW Pharmaceutical in the UK. It's the drug called Epidiolex. It's basically a purified, like 98% pure CBD that's been approved in the States for the use of in children with Dravet syndrome, Lennox-Gastaut syndrome, and a terrible syndrome called tuberous sclerosis. These are severe, fairly rare pediatric epilepsies, although I have all of these kids in my practice. However, what most of the families are doing now is they're including a portion of their high-dose CBD. So let's, for instance, max dose is around 20 milligram per kilo. They're doing 15 milligram per kilo as the Epidiolex because it's paid for by insurance, and then they're doing the other portion, let's say 5 milligram per kilo or even more, as the artisanal because they're seeing all of those added benefits when they combine the two together. And then here's another report. When I first started doing this, I was terrified of drug interactions. Remember, we take an oath, do no harm. And at the time, I really didn't know, so we just started very low dose and we tiptoed. It sometimes would take months before we would see an effect. And what we found was that I really didn't see too many side effects other than sedation. Remember, most drugs that patients use for epilepsy have a side effect of somnolence, and when you start stacking those drugs, you can really see the somnolence become a problem. It turns out that there really aren't too many drug interactions that we have to worry about in terms of epilepsy drugs. So in this review of 6 trials, I think this was published in 2019 or 2020, CBD did not affect CYP3A4 activity, which is part of the enzymes in your liver to help break down CBD. It's funny, I guess it didn't pick up, but CBD and clobazam increased exposure to major metabolites of both compounds. In my practice, I often am able to reduce the dosing of clobazam, which the families want. They see their child's personality start to come out. They see less sedation. One of the other drugs initially that we were concerned about was valproic acid, also called Depakote or Depakine, and there was a big concern about drug interactions. These patients that take Depakote or valproic acid get liver function tests anyway because it is a drug that is liver toxic. Adding CBD in the Epidiolex trials appeared to make that worse. However, I don't see that with artisanal, and again, that might be due to the fact that we're using lower doses with artisanal CBD oils. But overall, their conclusion in this study was there was overall low potential for drug-drug interactions between CBD and other anti-seizure drugs except clobazam. And it's really not dangerous. It's a clinical finding. The parent will report after you go up on CBD, it drives the clobazam to create a metabolite that causes more sedation. And parents will tell you, oh, I'm seeing my child more asleep, less active, and then we start to back up a little bit. We'll go up on CBD and go down on the clobazam. Of course, the neurologist tells them to do it the other way around, but most families are excited to have their child on a drug that is natural, that has very little side effects, even if it costs them out of pocket. All right, so other phytocannabinoids, I don't have time today to go through all of them and share my experience, but I'm happy to talk about it. But I use THCA, so remember Dr. Meshulam talked about that this morning. That's in the raw plant. That is before you heat it up, so it's in its raw form. And although they talk about it being unstable, I've been able to use it clinically without a lot of issues. But remember that in that little bottle of THCA tincture, there's going to be a small amount of THC, and any benefits that I see with THCA, I cannot say it's from THCA alone, or it may be from THC, it may be from the combination, it may be from something else in the bottle. But I have a few patients who do not tolerate CBD. I have 2 patients in my practice with what's called mitochondrial disorder, very complex, where basically the cells don't function properly, and they don't tolerate CBD. But I have 2 patients now in my practice with mitochondrial who are both seizure-free on THCA, low dose, non-intoxicating, non-impairing, and fairly easy to find. CBDA, there's just a few reports that came out, you can see just in the last few years, reporting some anticonvulsant effect, very similar to CBD. I have just recently started using CBDA, I'd say in the last 2 years, in my epilepsy patients, and I'm certainly seeing a decrease in seizures in patients who didn't get a full response with CBD. I also use Delta-9 THC in patients. Low dose, no matter what you hear or what you have heard, low dose THC is anticonvulsant. Very high doses can actually trigger a seizure, and I've seen that in 2 adults who ate 180 milligram THC candy bars. If you're not familiar, it's a very high dose. You should not do that. I advise you not to take that much THC right out of the gate. And they did have seizures. They recovered, and there was luckily no harm done. But in low doses, I find THC to be very helpful. And then just recently, we have a report out of Australia on 5 little girls with what's called Rett syndrome, which is a genetic disorder. It's pretty severe with epilepsy, autism, and some other behavioral issues. These patients, I have a handful of them in my practice, very intractable to treatment. And this report was very exciting. So CBDV, cannabidivarin, given to these children in about 10 milligram per kilo per day was considered safe and well tolerated, but you can see the seizure reduction, a mean of 79% reduction of seizures with 3 of these kids who had a greater than 75% reduction. And if you read the report, it's online, one of these kids was having like 370 seizures a month. So this is very significant impact with CBDV, again, non-impairing, and just became available from a company in Hawaii, my patient, and it's considered a hemp because it's low THC, so a number of my patients have started using it. I have 2 Rett patients that have started, and both parents, we actually weren't using it initially for epilepsy, for seizures, because these kids have fairly good seizure control on CBD, but we started using it for behavior and to see if there's any improvement. Both parents reported better eye contact, improved motor skills, and just kind of an overall kind of evening out of behavior. So this is early on, and I'd be happy to report what I find as I watch these kids. All right, so clinical pearls. So I usually start with a high CBD, low THC, somewhere between 20 to 1, 25 to 1, 30 to 1. I don't really go over that. Or I start with THCA. Who do I start with THCA? Children with mitochondrial disorder, or if a child comes in with a lot of medication, 5 medications, sometimes CBD just creates havoc, and I'll try the THCA to see if we can use a low dose to start seeing seizure improvement. I have them take this. Usually they're taking it orally. Many of these children will not hold it under their tongue, so they're swallowing it. Sometimes it's hidden in food. Many of these children have G-tubes, so it will go through the tube. But usually we ask the parents to make sure they're taking it with some fat, which can help increase absorption by 3 to 4 times. And I have them keep a log. CBD dosing, you'll see different reports, and as I've already mentioned, you can see the artisanal is around 6 milligram per kilo on average, and for the purified around 20 milligram per average, but every human is different, and so I start with 1 milligram per kilo per day, and I tell the parents this is going to be months. We're going to be doing months of titrating up, because we don't want just to slap somebody on some dose that somebody came up with from one study. It's what will fit that person's need. And remember, many of these families are paying out of pocket, so we don't want to give extra medicine if we don't have to. We want it to be sustainable over time. So I just increase every 2 weeks in 1 to 2 milligram per kilo per day increments. Why every 2 weeks? A report came out saying that it takes up anywhere from 2 to 6 days to see a steady state level in the bloodstream. So that first week is to kind of get it in, and the second week is for observation. The range of dosing that I have found effective is 5 to 25 milligram per kilo. I recommend that you use concentrated oil. If you're using a product that has 10 milligrams per 1 ml, so I like products that are standardized with some label that says how many milligrams per 1 ml, because then we can look and compare. If you have a 10 milligram in 1 ml and the child's dose is 600 milligrams a day, they're going to be taking 60 mLs, 2 ounces a day. That is not sustainable. And so we have to be able to have concentrated. In the United States, you can get CBD very low, 5 milligram per 1 ml, or very high, 200 milligram per ml, 400 milligram per ml. And so sometimes we start at with lower concentrated products, and as the child's dose increases, or if we're adjusting for a weight change, we move to a higher concentrated product. Ratio, as I mentioned, 18 to 1 to 25 to 1 are usually in there. And then I usually start with every 12-hour, but sometimes a child's metabolism will tell us that after that 8 hours, they'll go seizure-free, and then they'll have breakthrough seizures between that 8 and 12-hour, waiting for that 12-hour mark dosing, and I'll change it to every 8 hours. I have some patients at every 6 hours. It's all kind of customized to the patient's needs. In terms of THCA, this is a very low dose, 0.01 milligram per kilo per day. It seems to be quite impactful, and you increase in that same increment every 1 to 2 weeks. Of course, you want to pay attention to how much THC is in the product. I use and recommend a product to my patients that's a 20 to 1, so 20 parts THCA to 1 part THC. It has to be refrigerated in order to help maintain its stability. But there are products out there that are 1 to 1, which, remember, makes it very difficult to titrate up. CBD has such and THCA, they have pretty wide range of dosing, but THC is fairly narrow before you hit what I call the ceiling dose. And the ceiling dose is the dose at which someone is impaired or intoxicated. And of course, with children, we are trying to get them up and running, back to school, learning, being educated, participating in their life, and so we do not want them impaired. And usually less concentrated oil is preferred, again, because the overall milligram per kilo dosing is very low. And then just in terms of side effects, and I make this point, you read about side effects in studies, but remember, in clinical practice, you can address the issue of side effects so that your patients don't have side effects. And so when someone's on the correct combination of cannabinoids or on correct dosing, I don't see side effects. And if you see them, you adjust dosing, you adjust timing, you adjust the product, and you can usually resolve the issues. These are the most common, but again, still very rare. Sedation, and usually that's in patients who are stacking multiple sedating drugs on top of each other. Diarrhea, so this is described in the Epidiolex. I think I've only seen it twice in my practice. Irritability, this usually is with the kids with autism that I'm going to speak about. Appetite changes can go up, can go down. It just depends on the person and the cannabinoid being used. Sleep disruption can happen as well. The ceiling dose, which I've already mentioned, and changes in drug levels. And will you give me a heads up when I'm getting close to the end? Yep, okay. So I'm going to switch over to autism now. And like I said, this is the second most common condition I see, but just also remember that epilepsy and autism run together. There's an overlap, so many of my patients have both, which is very difficult for the families. You know, when I started out as a doctor a long time ago, it was about 1 in 250, I think, and now it's 1 in 44, so we're doing something wrong. Boys 4 times more than girls. There's no approved medications to treat core symptoms. In the United States, there's 2 FDA-approved medications. Both are atypical antipsychotics with a whole slew of terrible side effects, including diabetes and growing breasts and even lactating. So these are not drugs that parents are excited to use, especially since They don't really treat the core symptoms. There's a lot of off-label medication being used in the United States, antidepressants, stimulants, anti-anxiety medications, sleeping pills, you name it, with very low evidence to use these, but also very low efficacy and high risk of side effects. There was a study that came out earlier this year I thought was interesting, where they were kind of looking at what's on the horizon for autism, and they looked at fluoxetine and oxytocin, and they were very low efficacy, and the only study that showed any promise was the one which was a crossover randomized control trial with cannabinoids. So that's very exciting that that's being acknowledged. We know that these kids have abnormal inflammation levels in their brain and abnormal neuroimmune findings, as well as major gut issues. And when you think about where the endocannabinoid system is highly concentrated, brain, gut, immune system. Kids with autism, brain, gut, immune system. And it makes perfect sense to use cannabis in these patients. And again, here's the number of publications if you just Google autism and cannabis, and you can see it was a little bit delayed compared to epilepsy, but we're starting to see much more research since about 2019. You can see this interest in this. And remember, families are going to do this with or without a clinician. So I think it behooves clinicians and educators and everybody else to just get on board and try to be the leaders in this and try to help people do this the right way, as opposed to doing it on their own and potentially running into problems. So we have evidence of endocannabinoid deficiency or dysfunction in children children with epilepsy, and there's a few studies here. And let me just show you this, the pictures here. So is there a pointer on this? Yeah. Oh yeah, there you go. So here in 2013, there was evidence. This is in human children. They drew blood and looked at white blood cells. So remember that your endocannabinoid system exists on your white blood cells, receptors do. And here's in the patients that did not have autism. This is gene expression of various components, so type 1 receptor, type 2 receptor, and the other components of the endocannabinoid system, all expressing at what you would call physiologic or normal levels, 100%. And then you can see in the children with autism, completely off. So the endocannabinoid system expression from the genes is high for type 2 and low for everything else. And then a study came out, and so what this told us is that when you have upregulation of receptors, you likely have low levels of its ligand, which is anandamide or 2-AG. And so that was proven here in two reports. One came out of Israel, and then one came out of Stanford. This is the one from Stanford that was first. And you can see here, this is levels of anandamide. They actually drew blood to measure levels of anandamide. Now remember, anandamide is made on demand. This is your endocannabinoid. Made on demand, used and then destroyed by enzymes, broken down. So it's very hard to measure. So the group in Stanford figured out a way to measure blood levels. And the big question is do they reflect what's going on in the brain? And it appears that they likely do. But in children with autism, you can see it was low, and this is statistically significant compared to controls. But to the point where if you plot out the probability, they were able to actually diagnose, the researchers were able to diagnose autism without seeing the child. And so this is very important because remember, the diagnosis of autism is a clinical one where you evaluate the child based on their behavior, you do parental reports, usually have a psychologist involved. This may be a way to identify those kids much earlier on so that we can intervene earlier, not wait till they're 2 or 3 years old. I have parents in my practice who knew their child was autistic at the age of 6 months because how did they know that? Well, they have other children and they were able to kind of see the differences in that patient. And it might be subtle, but to a parent, it's not so subtle. And so here we have multiple reports, and you can go through the literature. So I gave you the references here of improvement in children taking cannabis. And so 3 of these are from Israel, 1 from South America, and all reports, and again, going through what did the parents say? Less rage, decreased anxiety, less agitation, better sleep, and so on. And also safe and well tolerated with minimal reports of side effects. And then we have a report from last year, which is the first randomized double-blind placebo-controlled trial that came out of Israel. And they compared placebo with a 20-to-1 CBD whole plant, remember all the compounds from the plant, versus a purified 20-to-1. And this is what they found. Is right here you can see the placebo. wrong thing, sorry, hang on. Placebo here, and this is the participants with a positive response. So 21% with placebo, and then the pure cannabinoids 38%, and then with the whole plant extract almost 50%, and this was statistically significant between placebo and whole plant, but not with the pure. And again, I don't know why we have to break the plant down to 2 products when the plant, Mother Nature gives us the whole plant. I don't know why we have to change that. And what they saw was all very significant findings. Improved behavior, improved BMI. So interesting, the kids that had higher BMIs over the course of using cannabis, they kind of normalized their BMI. Improved social responsiveness, and interesting, the severity of symptoms and the use of other medications was not associated with response. And I do have to tell you that when patients come to me that are new, I have no idea if they're going to be a responder or not. It's very difficult to predict. Some patients come in and I think, oh, this will be easy, no problem, and they're the most difficult to treat. And then other patients come in, I think, oh, no way is cannabis going to help this child. And then that lo and behold, they're one of the best responders. So I don't try to prognosticate anymore. I just say, you have an endocannabinoid system, let's try. And so certainly in autism, it's worth a try. And now I'm just going to speak about my research. So we published 2 papers in the last 6 months, cannabis responsive biomarkers. So there's something called pharmacometabolomics, which I had never heard of and had to be explained to me about 14 times before I understood it. But basically what it is you collect metabolites, the chemicals in your body that reflect chemical pathways. And you can collect saliva, urine, blood, even tissue, and measure specific chemicals and quantitate them, and to go back and look at what's the pathway, why are they high, why are they low, what is going on in the chemical pathway that leads to this metabolite. So we took 15 patients, 5 minutes, perfect. We took 15 patients. Oh, by the way, I'm working with this company called Camphermatics, but the reason I want to bring that up is because they had already identified what's called cannabis responsive biomarkers. And so these are some metabolites that they found in a healthy population, but also in other populations, so adults with anxiety or adults with pain, that responded to cannabis by collecting the saliva before they took their medical cannabis, and then they collected saliva after to see where did those biomarkers move, what was the change in those biomarkers. So we have some biomarkers that they've trademarked with looking at neuronal dysfunction, pain, aggression, and inflammation. And so what we did was we took 15 patients that were using medical cannabis already. These are all children with autism. None of them had epilepsy, just to try to make it simple. And these are kids who've shown a good result on medical cannabis over at least 1 year of care. And we did a behavioral survey in the morning. Then we collected the saliva. Then the child was given their routine medical cannabis dose, and then about 90 minutes to 120 minutes after, we did the same thing, a behavioral survey, and collected their saliva. And then we had 9 children who are typically developing controls. These were healthy children with no evidence of developmental delay or autism or epilepsy. And then we looked at the pathways to measure. And then I just want to show you this. So these are the patients you can see listed over here. So A1 through A18, and their ages and their gender, and then their dosing. So some took, M is morning, N is noon, E is evening. Some took 1 dose a day, some took up to 3 doses a day. The method that they took, so you can see this is all by mouth. But remember to, so we called an edible is when they hid it in food, tinctures if the child was able to hold it in their mouth. But you can see that all of these kids have customized dosing. So here you have a child getting mostly THCA, and then here's a child not getting any THCA but getting THC, CBD, and CBN. So again, this was all customized to fit the child's needs over, I would say, at least a year of treatment, or if not more. And then here what you can see, so let me show you this. This is 3 of our older patients, all boys. This is the physiologic range, so -2 standard deviations away from the mean, which is the straight line up and down from the arrow, to +2 standard deviations. This is where the children without autism fell in terms of their biomarkers. And as you can see, so this patient here, These are all their biomarkers that fall completely out of whack. Same thing here and here. And this is before they took their medical cannabis dose. And then after the medical cannabis dose, you can see this incredible impact of medical cannabis. And this is the first objective data we have to show that it's not just the parents saying, yes, my child is improving, but this is actual objective data showing us that these all these biomarkers are correcting. And what we can say is they're shifting towards the physiologic mean, shifting towards where most of us live. This is very preliminary. It's a small group. It's only 15 patients. But we tested over like 600 different metabolites, and this is statistically significant. And here's another one. So you can see here to the left, this is the pre, and this is just a different kind of graph here. So let me show you. Each one of these, A1 is a patient across, you can see, so going across, you can see. This is on from the second paper where we looked at just lipid-based metabolites, and you heard Dr. Mechoulam this morning speaking about all the various fatty acids or parts of the endocannabinoid system that are fatty-based or fatty acid-based compounds. And as you can see, again, what we found was improvements, really some spectacular results here. And so what we saw was that medical cannabis treatment optimized the level of these various biomarkers in 94% of children. And what we're very excited is that we're going to be working with another group that has a huge number of patients that we can do this on to help give us more robust data to see if this is really what the findings are. And so we also have scheduled a study on neuropathy, which is nerve-based pain, because we can measure biomarkers for pain so that we can document. And remember, right now we really don't have any way to measure success, and people they don't want to just hear, oh, my child is better. We want to see results, and I think that's a big way to get this more accepted into the medical community and to get other physicians accepting this. And then just, I think, one more slide. So this is Gavin. Gavin's in my book. I've been given permission to speak about him. He's showing you his Student of the Month award. Gavin is my longest patient. So I'll just talk about long-term risks and then I'll be done. So CBD does not affect brain structure in patients with epilepsy. That just came out a couple years ago. And then long-term CBD exposure in rats shows no effects on behavior. Everybody asks me all the time, well, what about long-term effects? And I always say, what's the long-term effect of a benzodiazepine on a child's brain? What's the long-term effect of an atypical antipsychotic on a child's brain? So remember, we have to ask not of just cannabis. It seems that cannabis is held to this double standard. We have to prove beyond and above that it's the safest medicine on earth. Well, under medical supervision, it's quite safe, but at the same time, do no harm. So we don't have really any long-term data to look at this, but again, when you're looking at, and Dr. Hart was talking about this morning, the psychosis, and everybody wants to focus on that. It's really a non-issue, except in people overdoing what I would say problematic THC use. That's where the studies are, and people want to compare that to medical use, and you can't. You just can't compare them, because these are patients with underlying endocannabinoid system dysfunction who are showing us, especially when you're being followed by a physician, I'm watching them. If something goes wrong, I'm changing the program. We don't leave them on high-dose THC for years, right? Certainly wouldn't be doing that. So every child gets a benefit-risk assessment, and then I just want to share with you, so he's been under my care 9 years, and this is a child who was terrorizing his family with his behavior, with his seizures. The side effects of the medication he was on were terrible. He was 4 years old and not speaking. He's been on high-dose CBD, THC, and THCA for epilepsy, autism. He has cyclical vomiting syndrome. He has acid reflux. He also has some undetermined genetic abnormality. And this is what we've witnessed, is progressing well developmentally and cognitively. He's learned to speak, read, do math, and write while on cannabis. So don't tell me it damages your brain. good focus and behavior at school and able to participate fully in his life. And I'll quote his mom, at school, he's an angel and everybody loves him. At home, he's a little bit of a devil, but he's having school success. And he was, I shudder to think where he would be if he was on his 14th seizure medication and antipsychotics for epilepsy. So he is certainly one of my favorite success stories. And there's just some of my patients. Thank you.
Thank you so much, Dr. Bonni. And now it's open for question and answers. If you raise your hand, we will find a way to, there you have, in the back. Please be brief. Again, I have to repeat this all the time. And don't get me wrong if I have to cut if you're speaking too much, so that everyone has the chance. Go ahead.
Quick question. Do you find that there's overlap on the whole plant versus the pure cannabinoid?
Overlap in terms of benefits for seizures?
That's right, yeah.
Yes, I think that, and I often, as I mentioned, combine them just so we can get the benefits of both, being able to go high dose with some support from the insurance company and then include some of the plant. But yeah, I think there is definitely overlap.
And is that normally like a 90-10 split? Like 90 on the...
So most of my patients will do either 50-50 or 75% pure because of the expense. And usually these are in the patients that require very high dosing.
Thank you. Great, thank you.
Excuse me. Any other question? Yes, there you are. I'm sorry.
If there is a need to give CBD with food, is better to give it a cold food, or is it the same with cold food?
I'm sorry, I can't hear you.
If we have need to give CBD with food.
Oh, with food.
Yes. It's better to give it with cold food, or it's the same.
So
with
what I
hot
recommend,
food?
right? I recommend with like avocado, nut butter, eggs, yogurt, full fat yogurt, anything that is high fat content has been shown to enhance absorption.
Okay. And another question: if we have need to give it by gastric button, is it expectable that the doses can be higher than by?
I didn't hear. I'm sorry.
You have to speak a little bit louder. It's really hard to understand here.
If we have need to give CBD by gastric button.
Oh, by the tube, yeah.
Yes. Is it expected that the doses can be higher than?
That's such a great question. So I have noticed that if you give it through the G tube or through a feeding tube, it appears that you probably have to dial up a little bit. But remember, it's very hard to compare because usually a patient's on one or the other, so it's not always easy. But I do have families that do both. They'll give one dose by mouth, and then the nighttime dose they'll give through the tube. I usually recommend through the tube to chase it with some olive oil or some coconut oil, MCT oil, so that, again, you're enhancing the fat.
Okay, thank you very much.
You're welcome.
Thank you. Another question, you in the front.
Hi, Dr. Goldstein. I wanted to ask if you have any experience with patients that have Down syndrome. That's my first question. And the second question is, if what you're prescribing is things that you can get from a dispensary in California, or is it an MD version?
Right, so great question. So I do have experience with Down syndrome, usually treating epilepsy or severe behaviors. And just like everybody else, there is an individual response, but I've seen some good results, yes. And then in terms, it's such a great question to ask about hemp versus dispensary. So in the United States, and in California, it used to be before, so remember, California was considered Wild West from 1996 to 2018, no regulations. So imagine what went on. It was buyer beware. I mean, you could get some really good medicine, or you could get something that was really out there. I had a patient, can I just tell a quick story? Do I have time? I had a guy come into my practice. This is when I was still seeing adults, and his 84-year-old mother, when he was so worried about her pain that he bought her 1,000 milligram brownie, 1,000 milligrams of THC. And she flipped out for like 3 days. And when he came in, on the wrapper it says incomparable potency. I said, she's 84 years old, what are you thinking, right? So it was crazy Wild West. Now we're regulated. They will not sell any hemp-based products in a dispensary. The regulation is very tight in California. It's medical cannabis only, meaning you have to be licensed, and it has to be double tested, so it gets tested by the manufacturer and labeled, then it goes to a distribution center where it gets tested again by a third party, and then if it fails, it goes back, and if it passes, it goes forward. So the labeling is very important. So now in a dispensary, so it went from getting whatever, now you have pretty good reliability. It's less than 10% variation from what it's labeled. In terms of hemp products, so if it has less than 0.3% THC by weight, arbitrary levels, but that's what they came up with years ago. If it's less than 0.3% THC by weight, you can buy it on the hemp market. The hemp market is still unregulated in the United States, and so it's still buyer beware. But what I have done over the years that I've been doing this, now 14 years, is when products came out 14 years ago, I would buy them and get them tested at a lab. So over the years, I've tested, so I can see who's consistent in the hemp, what's a product that's safe for a child to use as medicine. Because remember, if you get something's working and you go buy for the next month, and it's different, that's not medicine, is it? It's changed. So the standardization is very difficult with cannabis, but there are companies that are doing it, and those are the companies that we use.
I just got Shalom, Bonni. Just a quick question. Yeah, as a pediatrician who's been obviously having mounting empirical evidence about efficacy of CBD therapy versus big pharma drugs, and seeing this evidence that basically big pharma is turning our children into an army of, sedated, addicts to their drugs. Are you not infuriated? And also, is there any sort of groups advocating for legislation, fast tracking this into the public opinion? Because what's the point of turning a child into an addict and a zombie and a sedated person? And that's a lifelong disability.
Well, I agree.
For
with
greed,
you.
for greed of
Of
big
course,
pharma.
of course, I agree with you. I've been very clear about how I look at this. I'm not anti-pharma. I have patients who do combination. I'm anti-pharma when somebody slaps somebody on a drug. The child, look, I had a patient come in on 7 seizure medications, still having 10 seizures a day. What is the point? And there's no evidence to support 7 anti-seizure medicines. There's really no evidence to support more than 1 or 2 at a time. So again, it's this idea that we're holding cannabis we have to prove beyond a reasonable doubt that it is completely safe and so on, but yet we're not holding any other drugs to that same standard. That's where I have the problem. And so the way I look at it, though, is that I'm still hearing from parents that their doctor's saying CBD is last resort. You have to try the first 12 anticonvulsants. And at that point, I say that doctor's not necessarily looking at the evidence, right? And is not being open to what the literature is. All of the data that I just showed you is just from the last few years. And there's this horrific statistic out there that most physicians in practice take 17 years for the data in the scientific literature to get to them. Think about that. So we're fighting that. And so that's why I come and speak, and that's why it's important for everybody here to be educated on this and then to share with everybody else, because the only way we're going to get around this is with education.
Thank you. We have time for one last question.
One last
Yes,
question.
just
Sorry, I was just stopped you
Yeah.
before you left the stage. Just adding to the question that was raised where you talked about dispensaries against medicinal. Do we run a risk by having an adult use market that might cannibalize the medicinal market? I'm not saying that there shouldn't be an adult use market, but I'm talking about the self-medication point, rather than coming to a practitioner like you that can assess, and you've added to the point where you took away products and tested it and make sure that it was what it said on the tin, sort of thing. But do we run a risk with the adult use narrative cannibalizing the medicinal use? What's your thoughts on that?
So my thought is it should be separated. There should be a medical cannabis dispensary. There should be an adult use where patients can, or people, users can go and purchase. In California, a recent survey showed that 60% of people going into dispensaries are using it medically. And who are they getting advice from? From somebody standing behind the counter who, you know, nothing, everybody's very lovely in this industry. I have to tell you, I've met some of the kindest, most altruistic people in the world. But the guy behind the counter was selling auto parts last week, and now he's working at the dispensary. He's not qualified to talk to an 85-year-old who has anxiety and sleep disorder. He should not be advising, and that is where I see problems. Because what's happening is patients are not talking to doctors anymore. They're going in and just, oh, you know, you can just go buy it. So they go buy it, they have a terrible experience at home, and then they don't even want to go back. And now we've lost that person, and they go back on pills or so on. So to me, it should be separated. In California, it is not. It is all for one. So, and some dispensaries are medical only, some are adult use only, and some have both licensing. But in general, if you're over 21, you can buy what you want in California. So.
Thank you so much. Another applause, please, for Dr. Goldstein.